Okay, thank you guys so much for coming to the Quit the Nicotine seminar. I am Tina Shropshire, and at any time if you have questions, comments, concerns, feel free to just jump in. Okay, so nicotine addiction. People usually end up with an addiction because you end up hitting over 200 hits of nicotine per day. Okay, so that's 70,000 hits per year. 10 puffs per cigarette. After that, your brain gets used to and craves those hits. That's why it becomes very addictive. Your brain's constantly waiting for the next nicotine hit. Some studies have suggested that it's more addictive than crack cocaine. Chemicals in a cigarette. Chemicals that you can find in batteries, candle wax, industrial solvents, insecticides, toilet cleaner, barbecue lighter fluid, rocket fuel, carbon monoxide, arsenic, sewer gas, vinegar, and lighter fluid again.
Now, why does it taste so good?
I don't know.
And it doesn't.
Yeah, I imagine it shouldn't taste too great. Paint also.
When you're smoky.
Yeah. I think it's just more the addiction than anything. So around 500,000 deaths per year in the United States come from smoking. So 1 in 5 deaths, and there's more people who pass away from smoking than those who have HIV, illegal drug abuse, alcohol use, motor vehicle accidents, and firearms all combined. Why should you quit? Well, let's see, you're going to live longer. Your lungs will immediately work better. Within a year of quitting, your risk for heart disease declines by 50%. Within 10 years, your risk for lung cancer will be about the same as if you never smoked. Your teeth will be brighter. You'll have less trips to the dentist. You won't get so sick all the time. Usually when you smoke, you're getting bronchitis and asthma flares and everything that goes around, you get it. Your food will taste better. Your sense of smell will taste better. You'll smell better. Your cholesterol will improve. So the good cholesterol will start to go up and the bad cholesterol will start to go down. So hence less plaque in your arteries. You'll look younger, right? You'll have better blood supply to your skin. You'll have clearer skin, less wrinkles, and you definitely save a whole lot more money. So people are spending around $2,000 a year on cigarettes. I mean, if you do that over 20 years, you put 20 times 2. I mean, it's a lot of money. So definitely things to think about. Smokers are more likely than non-smokers to develop heart disease, stroke, and lung cancer. So you've got 2 to 4 times the risk of stroke and coronary artery disease, okay, than anybody else, and then 25 times the risk of lung cancer. So on the cancer side, these aren't all the cancers, because there's over 70 cancers that can be caused, but most common would be head and neck cancer. I had a patient who had head and neck cancer. I mean, he was unrecognizable from his pictures with all the surgeries and stuff they had to do. And it didn't end up becoming terminal. He had to have a tube feeding and feed himself through a tube feeding because he can no longer swallow, It was miserable. I felt really bad for him out of all the cancers to get. This is not a good one. Lung cancer, blood cancer or leukemia, stomach, kidney, pancreas, and colon cancer, bladder and cervical cancer. Chronic diseases, last thing anyone ever wants to have is a stroke or be blind, gum infections and gum disease, heart disease, pneumonia, chronic lung disease, reducing your fertility, and then hip fractures. So smoking can lead to lung disease. It damages the airways that go to the smart air sacs called alveoli, which this leads to basically emphysema and COPD, so you have airway trapping. So you see people walking around like little portable oxygen tanks because you're not getting enough air and blood flow circulation. So the cigarettes, stopping smoking is the number one thing you do for anybody who has COPD. And it's the most common cause of lung cancer. There's COPD. As you can see, the man is breathing, and his airway is constricted. He's got all this mucus in there. A lot of times people will spit, cough, spit a lot, get short of breath, wheeze, and hack because they're just not moving air like they need to. And if you ever want to be motivated to quit smoking, carry an oxygen tank around for 10-15 minutes and see if it's up. You want to do because there are people who do end up on that, and they have to have it 24 hours a day. You know, you really restrict where you go, who you're with. I mean, you really limit what you do. So the different pathogens, basically the nicotine raises your neutrophils. The neutrophils causes a deficiency in your neutrophils, which cause tissue damage, and then you end up with alveolar damage and emphysema, which is literally airway trapping. So people who pass away from emphysema and literally suffocate themselves to death. So smoking harms nearly every organ in your body. So sometimes things are immediate and some things take a long time, but we'll go through each part. Your brain, right? So the addiction center of your brain literally grows. They say that this is more addictive than heroin. I've had people tell me, yes, I quit heroin, but no, I have not quit smoking. And you would think you could kick this over heroin, you know? But it is a very hard habit to break. The brain develops extra nicotine receptors to accommodate the large doses of nicotine from tobacco, okay? And then when you don't get it, you start getting withdrawals, like anxious, irritable, and having really strong cravings. Your ears, you can actually end up with some hearing loss, okay? Reduces oxygen supply to the cochlea, a snail-shaped organ in the inner ear. This may result in permanent damage of the cochlea and mild to moderate hearing loss. Your eyes, you can end up with night blindness or just blindness in general. You're not getting the proper circulation to your eyes. You're getting constriction, that it basically decreases your ability to produce chemicals that allow you to see at night as well. So you can develop cataracts and macular degeneration. I don't know if you know what macular degeneration is, but that's where you're looking pretty much out the corner. You can only see out of your peripheral vision. And then cataracts is also cloudy central vision. So both of these can lead to blindness. The last thing you'd ever want to have is macular degeneration, because I mean, you're essentially blind except for out of the corner of your eye. Your mouth, definitely have way more cavities. It takes a toll, okay? Your oral health, you'll have more sores, ulcers, gum disease, you know, and definitely more risk for oral and throat, mouth cancers. Your face, right? It definitely puts lines and wrinkles all through your face. Even by the age of 30, you can start looking like you're 45, 50. Your mouth, the skin loses elasticity. Your face becomes dull and gray. Your lips get darker. Erectile dysfunction, enough said, right? Last thing you want is to not be able to perform when you get ready to, but smoking isn't selective. So not only is it cutting off the circulation to your heart, your eyes, your toes. I mean, you end up with leg amputations sometimes, fingers, toes, you know, because you're just not getting the good circulation that you need. It also will decrease your sperm count, and your kids could actually end up with some genetic defects, or it could be actually infertile. Elevated white blood cells. So your body gets into a stress syndrome because it's stressful smoking, you know. You're consistently introducing all those toxins, so your white blood cell or your immune system has to work and fight and fight and fight. And then when you actually do become injured or do become hurt, your immune system's weakened, right? Because it's always activated 24 hours a day from smoke, trying to fight that off. And then you have more risk for heart attacks, strokes, and cancer. Long time healing, right? I mean, you cut yourself, something that would have healed up in a day or two, now it's taking weeks, sometimes months. Sometimes it doesn't heal at all, just because your circulation's that bad. You know, the blood has the nutrients in it. So we definitely want to get good blood flow and oxygen, and smoking just doesn't really let you do that. Weakened immune system, right? So your immune system is less likely to fight off infections. You end up, like I said, getting everything that goes around. Every time you look up, you're sick. I remember my friend applied for a job. She's a nurse, and she's been a nurse for 15 years working in hospice, okay? So in hospice, at night, you go out to patients' houses if they pass away or if they're having problems. Well, she had to cover Livingston, Macomb, Wayne, and Oakland, so it's a big territory. Well, she had got a job in Mount Clemens General, and all she was going to have to do was go to Macomb Township, Clinton Township, and Mount Clemens. So way smaller, right? So she'd probably have about 40 people who could call as opposed to 400, okay? And way better pay, way better hours, way better everything, right down the street from her house. Well, they did a blood test, and it did come back positive for nicotine, and that excluded her from a job where she would have made $16,000 more a year. She would have had way more miles on her car, way more home time, everything. But at the end of the day, people who smoke cigarettes call in more. They're, more risk for heart attack, stroke, just long-term problems. That to the point that the hospitals just no longer hire people who smoke. So it could exclude you from, life events too. And definitely put you at more risk for like multiple sclerosis and rheumatoid arthritis, which are autoimmune disorders. More broken bones, okay? So the ingredients in cigarette smoke disturb your natural cycle of bone health. Your body is less able to form healthy new bone and breaks down existing bone tissue more rapidly. So over time, smoking leads to a thinning of the bone tissue and loss of bone density. This causes bones to become weak and brittle. Compared to non-smokers, smokers have high risk for bone fractures for sure, and way longer time to heal. So in women, they could have decreased bone density because the bones become thin and brittle, rheumatoid arthritis, cataracts, depression, menstrual problems, menopause, and pregnancy issues, harder time getting pregnant, harder time staying pregnant. You could even have a stillborn baby, and then have a baby that's born and then have a crib death. So secondhand smoke, definitely still just as many toxins, just as many risks to cancer. 70 different causes of cancer have come from secondhand smoke. So in 1964, the Surgeon General reported, and this is over 50 years ago, 2.5 million adults who did not smoke died from breathing in secondhand smoke. So not only you, definitely affects people around you in just the worst way, right? So kids get more middle ear infections, respiratory symptoms, impaired lung function, lower respiratory illness, sudden infant death syndrome, which is the worst thing you'd ever imagine, reproductive problems, lung problems, heart problems, nasal irritants, and strokes. All right, so again, when you quit smoking, you cut your cardiovascular risk just after 1 year. You drop by 50%, okay? Within 2 to 5 years of quitting, your reduced rate of stroke goes to that of somebody who never smoked. If you quit smoking, your risk of cancer of the mouth, throat, esophagus, and bladder drop by half by 5 years. 10 years after you quit smoking, your lung cancer risk drops by half. It's not bad, because people go, well, hey, I've been smoking for 40 years. What's the point of stopping now? All the damage has been done. That's not true. You can reverse some stuff. You have people who quit smoking, they go, I used to get sick all the time. I used to get bronchitis around this time all the time. I don't get this anymore. So 20 minutes after you quit smoking, your heart rate, blood pressure are back to normal. A week or two later, your circulation and lung function have improved. 1 year later, your heart disease is in half. 10 years later, your lung risk is in lung cancer, voice box cancer, pancreatic cancer are down as well. 12 hours after, your carbon monoxide goes down to normal. 1 to 9 weeks after, the smoker's norms, that smoker's cough that you get, the shortness of breath, wheezing, and all that is starting to go away. 5 years later, like I said, the risk for bladder cancer, esophageal, mouth, throat cancer, cervical cancer decrease. 15 years after quitting, your risk for heart disease is equivalent to as if you never smoked. So withdrawal syndromes. Okay, so insomnia, anxiety, depression, irritability, and cravings. Those are pretty much to be expected. Some people will say their brain is foggy, and like you're coughing up a lung because you're coughing up a lot of black stuff and that. Tremors, irregular heartbeat, seizures, hallucination, and convulsions are like on the very rare end of the spectrum, but could happen. So nicotine's out of your system within 72 hours after you quit, okay? And the peak of your withdrawal symptoms will be in the first 2 to 3 days. Usually after 1 to 3 months, it's gone. You said, did you quit? Is it okay to, is any of this true for you?
Yeah.
Okay.
Yeah, absolutely.
How long did it take for you to get over the withdrawal?
You know, it was, I don't remember exactly how, but it was a couple weeks.
Weeks,
Yeah.
okay. Cool. Did you
Yeah,
experience?
well, I was also a bouncer at a bar,
Oh,
so, I mean, I was always around it at the time.
oh gosh. And when I hear when you quit, it like to smell it and be around it is just awful.
It is.
You know, but it takes to stop for you to know that it's awful. So it takes at least 3 months for your brain chemistry to return to normal after you quit smoking. The last 2 symptoms to go are usually irritability and low energy. Any effective smoking cessation program has to take into account this long adjustment period. So usually it takes 3 months to get adjusted, okay? And so sometimes people will wean off, you know. To me, I'm the type of person, I just want to pull the Band-Aid off. Some people don't want to do that. Some people want to wean, so you can kind of like wean yourself down or use nicotine replacement in that case. Just like some people just don't want to go through the withdrawal, you know. So you got to first make the decision to quit. So identify your reasons for quitting. Can I ask your reasons?
Well, it was getting way too expensive, and
Yeah.
I was tired of everybody complaining.
Okay.
Because everybody else in my family quit,
Okay.
and that, just getting tired of
People
having to
hounding.
go outside.
Yeah,
And having,
it's a chore.
and people complaining about how I smelled.
Oh,
So
so
it was like,
it was just too much of it. It wasn't
Yep.
worth it.
Yep.
Okay. So yeah, your reasons. So whatever it may be, cost too much money, the smell, the inconvenience of it, the risk to yourself or your loved ones, you know. It's going to be a challenge. That's just it. But you got to rise to the occasion, set your goals, set your mind, review your mental list as you approach this quit date. So let's just say you go, you know what, May the 30th, whatever day it is, just set a date for you. It's a personal goal. If you tried quitting before in the past and you haven't, just keep going. Eventually something's going to work, okay? And maybe you weren't quite where you needed to be at that time. You're a different person right now today. So understand your risk. There's definitely some high risk times. There's times where you're going to be at a bar, you're going to be at a casino, you're going to be in a crowd, you're going to be under stress, you're going to be at a hospital with a loved one, all kinds of things that life's going to give you, especially when you call yourself quitting smoking. It seems like all of a sudden everything that can pop up pops up, right? So you have to know what things trigger you. And think about a time when you were in a situation where you smoked and you wanted to smoke but you couldn't, like jail or hospital or something where you just absolutely could not smoke. What did you do in those circumstances? You had to take your mind somewhere mentally and just deal, right? So think about those times and try to refresh what you did and do those things. So triggers for most people might be drinking coffee, finishing a meal, driving your car, using the phone, stressful situations, drinking alcohol, and social events. Okay? So all of those things you have to kind of have a plan for. If it's, you know, some that outweigh the other, make sure you have something in place so that you're ready to deal. So for example, if in the morning you have your cigarette with a cup of coffee, then maybe plan to have your coffee someplace where you can't smoke, like in the shop, or if it's while you're driving, take a different route to keep your mind occupied. If it's after meals, plan on going for a walk, brush your teeth, do something different. If it's on the phone, get those stress balls, get your hands busy, get rubber bands, you know, keep your hands as busy as you can. But basically you want to busy yourself to keep yourself occupied, your hands, your mouth occupied, so that you're not going back to that same habit. Get some zip ties or, you know, whatever you have to do. So first we want to have a plan. And, you know, there's a ton of different ways to quit smoking. There's medications, there's cold turkey, there's nicotine replacement. We'll talk about all of them, but the best plan is whatever works best for you, okay? So you got to stock up on supplies. Get gum, veggies, carrot sticks, hard candy, coffee stirrers, straws, zip ties, whatever you need to get, so that when you get to craving something in your mouth, you have it, okay? And we can talk about replacement individually if you like. and the potential risk and benefits of each one. But you're first going to pick your quit date, stick with it, know your triggers, know what you need to do. Let your determination build up. May 30th, May 30th, May 30th. Yep, this is it. I'm doing it this day. And there are people who you'll talk to, you go, did you ever quit? Yep, quit. The guy told me quit June 15th, 1998. So, whoa, it left with a big impression, and he's proud of that, And sometimes people pick like their grandkid's birthday or their daughter's birthday or wedding or some major life event so they can always remember, I quit the day that my granddaughter was born or something like that. There's Wellbutrin, Chantix. Those are just two most common medications that are used. They basically block the area in your brain that tells you need to smoke and then make the cigarettes taste really nasty. Nothing's 100%, but they're pretty good, like 40, 50% effective for most people. Let people know quitting is easier with support. Choose people who you think will be helpful, not people who are going to be counterproductive or too nitpicky, like on down your back. Tell them what they could do that's actually going to help you versus what won't help you. Get friends to distract you, friends to listen. Share struggles, but whatever friend you get, make sure that they're not going to be like laying the weight of the world on you because you don't need something to trigger you to want to go smoke. Cold turkey, so 90% of people will try this, but it's only effective for 4 to 7% of people. So, I don't know. Some people need that cold turkey. You know what? They just know their self. Hey, this is what I need to do. This is how I need to do it. And if that's what you need to do, then okay. But just know that only 4 to 7% of people really can do that. You could do cognitive behavioral therapy. You could go through the employee assistance program and get with a therapist and identify triggers and make a plan to get through the cravings. You could do nicotine replacement with gum, patches, inhalers, sprays, or lozenges. The gum, patches, and lozenges are covered, but the inhalers and sprays are not. So definitely want to make sure that you're using something that works for you. And usually you just wean that down. So chewing the gum.
What about the people that vape and that? I mean, are they immune from all these health risks?
So the jury's out on the actual health risk with vaping. You just know that you don't have the 7,000 carcinogenics that are in the actual cigarette itself. But it's too new to know.
I mean, has nicotine itself been proven to be a carcinogen?
It's not in the form when you put it into, cigarette, then yeah. But nicotine itself is a vasoconstrictor, and it puts you at risk for heart attack. Yes, it does still put you at risk for cancer, not as much as it would if it's, combined. Mm-hmm. It's way better to just use nicotine replacement as opposed to cigarette. If you had to pick one, it's definitely going to just be nicotine replacement. But it's still going to constrict your vessels, still going to put you at risk for blindness, high blood pressure, stroke, heart attack, because it's a vasoconstrictor. Okay? When you're chewing, you chew very slowly several times. When you start to notice a peppery taste or slight tingling, you just park it, put it in between your cheek and your gum, and then leave it there, and then you chew again until you get the tingly, peppery taste again. And just repeat that cycle until the taste and tingling are gone. So Wellbutrin and Chantix are both prescription medications. They both are very effective, about equally as effective as the other one, and usually take 9 to 12 weeks to work, but not to start working. They start working right away, but usually you stay on them for 3 months. So when you're eating triggers,
can you go back just a second?
Sure.
Study participants received up to 10 minutes of counseling at each visit. All right.
Okay.
Yeah.
So quitting, you got 4 Ds. You're going to delay, like try to change your routine big time. Distract, talk to somebody, do something else. Deep breathe and drink water. Drinking water is going to be great. Okay, so maintenance and coping, right? Just one day at a time. Don't look way far in the future. Start thinking about months from now. You know you're going to be in this situation. You know you're going to be at the bar. Just don't even overwhelm yourself. Just deal and stick with the right now. okay? And then the days will start to turn into weeks, weeks to months, months to years. So maintenance, think of how strong you've been so far. Remember the reason that you start quitting in the first place. Refuse to let the addiction win. Think of the benefits to your health, your finances, and your family. Remind yourself there is no such thing as just one cigarette. And then start to see yourself as a non-smoker. And I think that's probably the most profound thing. See yourself doing it. See yourself successful. Your mind is huge. If we use our mind like we should, it's scary what we could pay off, what we could do. The moral of the story is you definitely can quit. I am so available to talk to you if you want to do some treatment options with me. You can schedule a private a meeting with me and we can make this thing crack. Any questions or concerns? Thoughts? No? Did you do anything when you were quitting? Did you do cold turkey? All right, you're in the 4 to 7%. Very good. Good. All right. Well, thank you guys.
Thank you.
Shutting